It's a disease that affects an estimated 5.5 million women and men in the United States. However, only about 1 million patients are properly diagnosed and treated.
Interstitial cystitis bladder pain syndrome is defined as an unpleasant discomfort or sensation related to the bladder and associated with lower urinary tract symptoms, including frequency and urgency. Oftentimes, patients' lives are impacted far beyond the physical symptoms.
And we traveled to Northern California to learn more. Take a look.
Today, Stacy Carnazzo is meeting with her urologist. Since her official diagnosis of interstitial cystitis bladder pain syndrome in 2010, these appointments have become a part of her routine.
Well, good afternoon.
For her, it's a relief to finally have help. 8 years ago, she had no idea what was happening.
I would be out hiking with my friend. We'd take long 2-hour hikes, and on the hike, I would notice that I was feeling like I had to go to the bathroom, and I thought, oh, that's really strange because I just left home and I shouldn't be feeling that. But, you know, it'd kind of go away, and I didn't think twice about it at the time. Until a couple months later when it was coming back and I was feeling like I needed to go to the bathroom all the time, and having constant feeling of having to urinate. One time I expressed to my doctor that I feel like I have an elephant sitting right here on my abdomen at all times. It's just so much pressure that you never have any relief from it, and it's constant pain. I would say that I probably used the restroom 20, 25 times a day, and at night, 5, 6 times a night, waking up to go to the bathroom, but not really having to go to the bathroom, so it's very frustrating. Sometimes it's burning, which is really uncomfortable. Sometimes it's just strictly pain. A lot of times for me, it's just constant pressure of having to use the restroom, and no matter how often I go, I don't have any relief from that feeling.
So far, so good. It's been a pretty good week also, so I can't complain.
As a first grade teacher, she would have to leave her classroom repeatedly. Daily life was a challenge.
I don't have a job where I can just walk away and say I need to use the restroom, I'll be right back, to 25 6-year-olds, because it just doesn't work. Fortunately, the way my classroom's set up, I have open doors with other teachers, so I would be able to open the door, and my colleagues were very supportive and helpful, and I would just run out and use the restroom fairly close, so it was pretty quick, and it didn't help me to use the restroom. I still felt that constant pressure, but I just had to do what I had to do. Oftentimes when we'd go somewhere, that's what I would worry about. Can I make it? How many bathroom stops are we gonna need to get to Davis to see my kids at college? Where could I go? Whenever I went somewhere, it was the first thing I said was, where's the bathroom?
Interstitial cystitis is a poorly understood but identifiable disease. Patients have specific lesions in the bladder that can be biopsied, can be followed. And bladder pain syndrome patients have very similar symptoms, but they have normal bladders. And it turns out that the two conditions are not the same.
According to Dr. Payne, proper diagnosis of ICBPS comes with an in-depth consultation, careful review of patient's history, and a thorough physical exam.
We're trying to figure out where the pain is coming from. And we think that starts with a good history. How did the problem start? What was going on at the time? What are the things that make the pain better and worse? And then usually the only routine testing that we might do on a patient the first time would be to look at the urine under the microscope, get a urinalysis and culture, and possibly get a check of how much urine is left over after they urinate, a post-void residual. We find that that's typically enough to start treatment, to make a working diagnosis. For bladder pain syndrome, if we think that a patient has lesions, then of course the key test is to do a cystoscopy, to look in the bladder, to see the lesions, to biopsy the lesions.
That would be fantastic. I would love to see someone else and get a second opinion.
When I first received the diagnosis, I was extremely, extremely uncomfortable and in pain. And I was freaking out, basically, and crying all the time, crying. And at work, I'm crying. At home, I'm crying. Everywhere I go, I'm crying because I didn't know what the future was going to be for me. I didn't know if I was going to ever feel better, ever be able to enjoy going on a trip with my family, doing things with my family. Just things like that. I was worried that I would never get to do anything enjoyable again. When I first met with Dr. Payne, I was really hopeful that I would get some help, and he was as well. Like, no, there's so many things we can do and so many things that are available to try.
Stacy is an instructive. Frustrating is not the right word because she's not frustrating, but her problem is frustrating. So she'd had bladder pain syndrome symptoms for a long time before I started seeing her. And we went through her treatments, and several of the treatments that she had been given, at least a couple of them initially, seemed to be helping her. And then overall, though, year to year, she just kept getting worse. We thought we're going to be able to add treatment, get her completely free of symptoms, stabilize things, and maybe then in the long run actually take her off medicine. We've never been able to get her 100% free of symptoms. That's been particularly frustrating because even though she's functions at a very high level in her day-to-day life, she still almost every day has some symptoms. And with her, I've not been able to crack the code on that one.
Communication is key between both patient and physician. It's a very real disease that can create consternation for all involved.
Equinox is interested in ICBPS because of the high unmet medical need. There are over 5.5 million women and men in the United States with ICBPS today, yet only 1 million of these patients have been diagnosed and treated. And while for some conditions 1 million might sound like a lot of patients, in this case there are few effective treatment options, so many of these patients are left in continued pain, especially bladder pain. So while patients may have a number of options, most of the patients find themselves frustrated, not finding a regimen that works right for them, especially to manage the bladder pain. Only 2 of these therapies have been US FDA approved over 20 years ago.
Thanks to Dr. Payne's continued treatment, Stacy is making progress.
It's improved immensely because he's got me on different medications, different routines, and I'm feeling much, much better. I'm not completely well, I would say, but I have improved to where I can work. I can do anything that I want to do and not necessarily worry all the time about how I'm feeling. My best advice would be to be your own advocate. It's a miserable condition to have, and if you can find someone, the right person to help you, then you can get help.
We see an opportunity to improve ICBPS awareness, hopefully increase diagnosis, and if our clinical trial program is successful, introduce a new and effective treatment option for patients. If not, hopefully we've advanced the science and understanding of ICBPS through our clinical trial program.
The most important take-home message is that isn't one entity. And therefore, you need to work with someone that will help you understand where your problem is coming from, dissect out your disorder, and treat you specifically rather than just doing an algorithm that they think applies to everybody that has those symptoms.
My youngest is graduating from college in June, and I'm looking forward to being able to travel, go places, do things with my husband, and knowing that I'm at a good place, I can manage my ICBPS, and my future looks great.
So glad her future looks so bright.
Absolutely. And here are some websites that will provide much more information about ICBPS. The first one, aqxpharma.com. You can also look at ichelp.org or icbpstips.com.
That was a mouthful.
I know, and if you didn't get all that,
And you can also visit our website at thebalancingAct.com, and we will be right back.